Hi, we are Nursing 105 students from Montgomery College. My classmates and I are excited to share our experiences in the nursing program with you in order to prepare you when you enter the program. In the first day of your nursing program, you will receive a few papers, like that much, and you have to be finishing reading them until the next Monday. Next, you can find a very good friends, classmates that can help you with reviewing the objectives, and you can study together and you can exchange the objectives. Your lectures are gonna be Monday, however there will be 4 hours. In order to prepare for that time, it's better to read the skin integrity chapter before the school starts, in order to prepare you how to prevent yourself from getting a pressure ulcer. So this is going to be your Bible for the first semester, and one chapter is approximately 50 pages. In order to keep up with the long readings, you have to drink a lot of coffee. So the coffee, water goes together. So you may know that coffee is a diuretic, so in order to drink a lot of coffee and not to be disturbed from your studying, after you pass your surgical asepsis and urinary catheter insertion simulation, I will suggest you to use the Foley urinary catheter so you don't have to be disturbed while you're studying.
When you're in nursing school, you really need to find time to relax. This is how I should relax. So yes, I should really be doing yoga to relax. However, in reality, this is my form of relaxation. For some reason, it really, seems to help my endorphins or something. I'm not really sure what it is. It's not very healthy though. And I really advise against it. No, not very constructive. And I'm a nursing student at Montgomery College. This has been my first semester and I can't believe that I actually made it through. So there are some things that I want to try to convey to you that have helped me get through the semester, or things, actually I should say, things that I've learned through doing the wrong thing. So let's get started. I'm going to come over here to my desk in my wonderful office that I've set up, and I'm going to show you that the appropriate way to study. Oftentimes we find ourselves not really planning ahead. And so I'm offering this suggestion that you need to start doing your study guides well ahead of time. I'm talking like the day before the lecture. Then that way you fully understand the lecture and you can learn from it. Let me demonstrate. I'm reading, I've highlighted, and now I'm working on the study objectives. So this is what you should do to be successful. I'm not saying I do this, because I don't. But this is what you really need to do. Now I'm going to show you what I actually do, and then you can choose which of these.
This is what our mom really does.
Never cram. So one of the things that I've noticed that I've really neglected since nursing school started, and what I really should do, is spend more time with my girls.
Mom, where are you? We want to spend time with you.
Leave me alone, I'm studying!
Whoa.
What I would like to start doing is reading a little bit of the Twilight book out loud to one another every night. So this is what we should do.
First year nursing student at Montgomery College. You can't make it through your first year of nursing school without support. So in order to manage your time and your academic studies better, you need to use the resources that are available to you, starting with the SimLab, this area here on the 3rd floor, and the Medical Learning Center, the reference librarian across the bridge, the place we never go, is always willing to help you. These are really important, especially academic journals like the Journal of Nursing. All of those, she can help you figure out how to navigate them, how to cite them, how to use them to your advantage, because as we go through the program, not just your first year, but going on to the end, she'll be your best resource. Also, books. Investigate where your books are the cheapest. The bookstore is not always going to be your best option. Sometimes the publisher has cheaper prices than the bookstore does. Chegg and Barnes & Noble, who also rent books, will often, when they take a book out of rental circulation, sell that book at a really reduced price. So you wind up with the current edition that you need for your studies for much less money than you pay in the bookstore. Study groups. Starting with your clinical group, the people who you see the most consistently at a time where you can share and help. Those folks are probably the best place to start with a study group. People who you might have been drawn to in lecture or similar interests or similar backgrounds, they might also help, but having a study group really helps. And if you use something like Google Docs, where everyone can share their notes on the objectives that we're all required to do, then you can get real-time responses from your study mates, and you don't necessarily have to worry about work schedules or being able to meet in person. Also, any of your people that are available through the mentor program here through the lab, they can help you. Mentors, they're busy with their studies too, but they also have some of the best advice I've found. So sign up for a mentor, and once you can, sign up to be a mentor and get your own mentee. So good luck on your first year in nursing.
Hi, my name is Catherine Ludwig. For my part in How to Survive Nursing School, I am presenting the Clinical Survival Kit. Pretty much, they give you this bag that comes with a dressing and change tray that will come in handy for practicing, Foley catheter kit, which will be perfect for practicing also, sterile gloves so you can practice how to put them on without contaminating the sterile field, gown in case you have trouble putting on your gown, a mask, basically stethoscope and blood pressure cuff. Even if the blood pressure cuff isn't needed, it helps to have the blood pressure cuff so you can learn how to do manual blood pressures in case, let's say, there's a power outage in the hospital. In 121, you are learning how to do head-to-toe assessments. It'll help to have a cheat sheet. Here's mine, so you don't have to remember everything you learned in 121. An SR form, so you can know what's going on with your patient, situation, background, assessment, and recommendation. This is the most useful book that 110 has to offer. It has how to speak Spanish in the back, religious needs of some patients, lab values, and other helpful things, all in a heartbeat. Basically, it's the fundamentals of nursing clinical companion. You need some water so you can stay hydrated. Dry shampoo. I know everyone likes to shower, but if you're like me and your clinical is at 7 a.m. until 5:10, you kind of want to switch your shower to the end of the day in case you get covered with secretions. So spray this in your hair so your patient can't accuse you of smelling bad. Eye drops, because when you wake up early, sometimes your eyes are dry. A snack, so you don't go hungry while you're helping your patients out. Some gauze, so you can practice wound care in the lab or in case you can't find gauze in the hospital. Some unscented lotion, because washing your hands and hand sanitizing your hands every time in the hospital can be really demanding on your hands. So practice self-care on yourself as well as your patients. You'll need some Advil in case you have a headache. You don't want to be crabby to your patients. And most importantly, if you have a early clinical like me, you don't want to look like you just rolled out of bed. So packing a makeup palette kind of helps. Mine has blush and bronzer and eyeshadow. Of course, if you don't wear makeup, it's not needed. And if you're a male, well, just be sure to wash your face and brush your teeth and put on clean clinical uniforms. Some gum. After you have lunch, you don't want your patient to smell what you had for lunch. And that concludes my clinical kit survival. I hope you will also come prepared to clinical just as I have. Good luck in nursing school. Thank you.
It was stressful one semester, but we all did it. Now it's your turn. Good luck.
I'm a survivor. I'm not